everyone, it's Dr. Gambhir. Wanted to talk to you a little bit about vein therapy today. So for some of us, when we're young or as we grow older, we start to develop more bluish discolored veins or red veins on our legs, and those can be cosmetically disturbing. All of these can be treated, but the entire process needs to be looked at in a pretty systematic manner. So I often think of the veins as the plumbing system in the home. The veins that we see on the surface, the red veins and sometimes the bluer colored veins, those are like plumbing issues on the first and second floor. And if there are enough of those issues, then we really need to go down to the basement of that house and look at the veins in the basement as well. In this case, the best way to access those veins is to take an ultrasound and look at those deeper veins. We're looking for what's called reflux in the greater saphenous and lesser saphenous veins. And reflux means that the blood is traveling in the wrong direction. Blood is normally meant to travel from the veins, wherever they are, back to the heart. But if blood is traveling in the opposite direction, it's back flowing from the basement, to continue with that example, back to the first and second floor. And that really feeds the vein issues on the first and second floor. So under ultrasound guidance, interventional radiologist, and typically under insurance coverage, those veins can actually be shut down. Once that process is completed or in parallel to that process, then we can actually take sclerotherapy solutions. These are medicinal injections to shut down the superficial veins. We will complement those sclerotherapy solutions with lasers as well. So they both work in unison. Lasers heat the vein to kind of heat up the hemoglobin or the blood inside the vein to create a heat-based seal of the vein. The chemicals that we're putting in, called sclerotherapy, really help to melt that vein, or seal that vein, from the inside out, but both are very helpful. Veins will typically take 4 to 6 weeks to heal, and then we can repeat that therapy again. We only want to treat the veins which are cosmetically not functional or are actually doing a disservice to the general blood flow of the body. So there are a number of veins which we can see cosmetically but are actually very functional for the body. So those are veins that we don't want to treat at all. Consultations are always the best way to get the right information in the office. Certainly if you have questions, feel free to give us a call. Thanks.